Good afternoon, everyone, and welcome to today's demonstration on human immunodeficiency virus, commonly known as HIV, and acquired immunodeficiency virus, also commonly known as AIDS. Today, we'll be discussing everything that we need to know about this virus. On today's agenda, we will be discussing what is HIV and AIDS and its risk factors. We will be discussing who is at risk, what our testing and treatment options are, what the timeline for this virus is, why we should be concerned, and how to move forward while protecting ourselves and the community. To begin, what is HIV and AIDS? HIV was discovered in the early 1980s and is a virus that attacks the body's immune system. It is the virus that led to what is now known as the AIDS epidemic of the 80s. As of 2022, last year, over 40 million people globally have died as a result of AIDS, which is the result of HIV. Many people with AIDS carry a high viral load that can be spread easily to others and makes them incredibly at high risk for any illnesses, as their immune system cannot fight them off. Who is most at risk for contracting HIV and AIDS? There are several ways to contract HIV and AIDS through sexual activity, the sharing of needles, mother to baby, such as breastfeeding or through childbirth, or blood contact. Anyone is at risk at any time for contracting HIV or AIDS if they do not take the necessary precautions. However, due to high proportions of the virus in certain demographics, there are certain populations of people who are considered to be more at risk for contracting the virus. These demographics include people who fall in the LGBTQ spectrum, African American women, transgender women, youth between the ages of 13 and 24, and people who use intravenous drugs. There are several different testing options for patients depending on when they were exposed. There are 3 tests that are the most commonly used: the antibody test, the antigen test, and the NATS test. All must be done in a lab. The antibody test is a test that looks for the antibodies present in a person's blood or saliva and can detect HIV 23 to 90 days after possible exposure. The antigen test looks for HIV antibodies and antigens and requires a blood test. It cannot be done through saliva and can be done 18 to 45 days after exposure. The NATS test looks for the actual virus itself within the bloodstream and can detect the virus from 10 to 33 days after exposure. It is also a blood test. This is the timeline of the infectious window for HIV. Upon contraction, the individual enters stage 1, which is acute HIV. During this time, an individual may experience a lot of different symptoms similar to the flu, so sweats, a fever, swollen lymph nodes, something very similar to that of the flu. At this point, an individual would want to go get tested, and then that would determine what kind of symptoms they would experience in stage 2, which is chronic HIV infection. During this time, HIV still remains active, but with proper treatment, the symptoms may disperse and may stay in their blood system for decades and never experience full-blown AIDS. During both of these stages, the person, however, still remains incredibly infectious. However, without proper treatment, the individual can go into stage 3, which is full-blown AIDS, which is where the individual becomes severely immunosuppressed and become very at risk for any sort of illnesses. So why is this important? How do we prevent it? It's important because it's still very, very prevalent in our community. And even though we have better testing and treatment options, it can still be a death sentence for many who are not able to afford their treatment, as well as the fact that there are many developing countries such as Africa where prevalence rates are incredibly high. So it's really important to practice safe prevention methods such as safe sex, getting tested immediately after having unprotected sex with a new partner, practicing proper sanitation practices, always wearing gloves and proper protective equipment while handling someone's blood, never sharing needles. And if you have had an exposure, get tested immediately and start taking the PEP, which is a prophylaxis that prevents the virus from taking hold in your body. Thank you so much for your time. If you have any questions, please let me know.